Thank you and good afternoon. During this time when our medical professionals and essential workers are leading our community through this public health crisis, I want to take a moment to acknowledge that today is Workers' Memorial Day. Today is a day we remember and recognize all workers who have been injured, disabled, become sick, or killed while carrying out the duties of their job. We've seen stories from frontline healthcare workers who not only contracted but sadly died from coronavirus. And today we want to thank every worker, both healthcare and essential workers, for everything you're doing during this global pandemic to protect us, to provide the essential services, and keep our communities moving forward. And a special mention to those workers and their families who have become ill or died as a result of their work. Today, the governor outlined his 6 criteria needed forward to move forward. And in particular, he talked a little bit about the stages of opening, with us currently being in step 1. Our ability to move to step 2, which provides additional opportunities for businesses, he said, is weeks, not months away. But it is based on not only our ability to continue to see flattening in terms of our impact on our healthcare system, but also the ability to have in place a robust system for testing, tracing, and treatment. We are very focused on meeting this challenge in San Diego County. Our ability to provide robust testing, the proper contact tracing, and the treatment and isolation capacity will be a critical one once we start to look into open up businesses, schools, childcare, and other types of opportunities. Without those capabilities in place, the virus can quickly take hold and we could see widespread outbreaks. If we are able to quickly test everyone who is symptomatic or is appropriate to be tested, quickly find others that they may have been in contact with, isolate and treat those positive individuals, it will go a long way towards putting us in a new posture of kind of this new normal where we are able to contain coronavirus as we move forward. In a moment, I will introduce Nick Mascione, our Director of Health and Human Services, who's going to be leading our testing, tracing, and treatment, what we call T3 effort. He will provide a report out on our testing task force, which met last night, along with some updates around our efforts around all 3 of those, because the 3 of these things, the testing, the tracing, and the treatment, all go together in one thing that is vitally important for us moving into future phases. Another item mentioned in the state briefing was our ability to adapt. Our ability to take steps to minimize risk. A part of this is face coverings. Wearing a face covering during the coronavirus pandemic is a preventive measure that we can all take to protect ourselves, but also we take to protect others. Wearing a face cover is similar to putting on sunscreen when you go out in the sun. When you put on sunscreen, the sun does not go away. The harmful rays do not go away, but it many times, if done properly, will stop or limit their ability to burn your skin. When you wear a face covering, coronavirus doesn't magically disappear, it doesn't magically go away, but it similarly provides a level of protection, both to yourself, but in this case, others who may be around you. We understand it may be inconvenient. We certainly understand it will take some getting used to, but it is an important part of our COVID response, and it is an important part of us changing our daily activities and changing our posture that will begin to facilitate the easing, and as we facilitate that easing, hopefully contain the spread, which will allow us, as we begin to gradually turn that dial, to continue to see positive progress. We want to continue to move forward. We don't want to take steps forward that require us to then move backwards, and a part of that is us adapting to the new realities of what we will face and confront until such time as we have a vaccine or widespread therapeutic treatment, or perhaps both. Dr. Nick Infantidis is here today, and he is going to share some of the science, some of the data, some of the medical expertise on why face coverings are a piece of the broader effort that we do as we move forward to. According to one report, as of April 22nd, 51 countries are now requiring face coverings when in public, and we suspect this number will grow. In the early days of our response, we required face coverings for employees at 7 essential businesses who were interacting with the public, and after some additional adjustment, it seemed to have worked out well. We also had a strong recommendation that the public wear them when they go out, and now we have taken the final step here in terms of requiring them effective Friday. Again, having a face covering helps to slow the spread of the virus. It helps to prevent you from being in contagion with other folks if you may be positive. And it does not replace physical distancing. It does not replace washing your hands. It does not replace the other guidance that we've given, but it is a strong additive to those. And as we begin to contemplate loosening some of the restrictions on our public health orders, we have to also change our mindset. We talked yesterday about the need to be more aware and have more commitment to how we go about daily life. And given we will be existing in a place where the threat from coronavirus remains there until we have a vaccine or widespread treatments, we're going to have to modify a little bit each of our behaviors in an effort to better contain the spread. And so we appreciate Dr. Nick being here to share with us some of the medical perspective and science behind why this recommendation is seen as so important. A quick update on the homeless. To update, out of the total cases county-wide, irrespective of the convention center, we are currently standing at 24 of our total cases throughout San Diego County have tested positive. As it relates to the convention center, it is still just 2 positive cases there. Yesterday, 104 tests were performed. We do not yet have the results of those, but total tests administered to date is 767. This includes 530 residents, 237 staff. Out of this, we have 2 positives, 644 negatives, 17 that were indeterminate and need to be retested, and 104 which are pending results. Now I'm going to get into our daily report on our metrics and charts. You will see today we are reporting 173 new positive cases, a significant jump in testing from the day before, 2,545 total tests performed. This puts us at a 7% rate of positive versus total testing, which is much better than yesterday. Again, the day-to-day results are less important than the broader trend line. Here on the chart, you see in orange the daily positives. In blue, you see the total testing, and that purple line represents the cumulative or 14-day rolling average that we see, and this is a number that we would like to see downward trend. Second, we will look at our hospital capacity system. You saw in the governor's briefing today, they talked significantly about hospitalizations and ICUs over time and the desire to see that flat. Here we have reflected COVID-related patients. These are both known COVID and suspected COVID in our hospital system in real time in orange. In blue, you can see the total beds in use. And then again, to repeat what we talked about yesterday, the dotted purple line is current bed capacity. The green line is licensed bed capacity. Current bed capacity is a better number to use because it reflects actual available beds that are in our regional healthcare system and our staff. This is not including federal assets and federal resources. Final chart here today reflects our doubling rates, which you can see the doubling rates for positives at 18. Again, this is a 5-day average, rolling average. It takes into account exponential growth. Our estimated number of recoveries, our hospitalizations there, you can see the doubling rate at 28 days. ICUs, doubling rate at 35, and then a few additional deaths today that Dr. Wooten will cover in her report. I'd now like to turn it over to Nick Mascione, our Director of Health and Human Services, who is leading our efforts around T3, testing, tracing, and treatment, to give you an update on the testing task force, testing in general, but also to reinforce the point it is not just testing, it is all 3 of those components that have to go together to prepare us to move into the future. Thank you.